Hey everybody, I'm Chris Ireland. I serve as the Director of Clinical Education for the DPT program at Faulkner University. First off, let me just say thanks. Thanks to you as CIs, thanks to your SCCEs for making these opportunities possible for our students. I know many of y'all have exchanged a lot of emails with me back and forth, and so I'm excited to have our students with you. And I hope that throughout this process, I look forward to getting to meet each of you guys. So the point of this video, really, I want to give you a little background to our program, talk about assessment of our students, what the expectations are, and then finish with some requests for some assessments of us as a program. So background about our program, we started the PT program, took our first cohort in the fall of 2021. Our program is part of a College of Health Sciences in which we have PT, OT, speech, and PA. The PT program is an 8-semester program where the students have 6 didactic semesters, followed by 2 clinical education semesters. And during those 2 clin ed semesters, they have 3 rotations, so 10 weeks, 10 weeks, and 12 weeks. In those first 2 10-week rotations, one of which is obviously this first one, students are required to complete either an inpatient or outpatient rotation. With the way we have our curriculum structured, the students have completed all their didactic work prior to clinical education starting, other than a part-time rotation that they do during their second year. And so we really don't mind if they do an inpatient or an outpatient rotation first, because they ought to be prepared for both of those settings. Once the students get to their third rotation, the 12-week rotation, that's more or less an elective rotation. If they want to go into a specialty area, that's perfectly fine. Or if they want to repeat and go back to an area of outpatient or inpatient that they've previously had an experience with, that works as well. So we are using the CPI. In May of 2023, the CPI was updated from version 2.0 to version 3.0. I really like a lot of the changes that they've made. 3.0 was reduced from 18 sections down to 12 sections. I know often I was a CI myself once, and the redundancy in some of those 18 sections often made it challenging and time consuming. So they dropped 6 sections, not dropped, but they integrated them and reduced some of the redundancy. So 3.0, I think, is going to work out great. But with that, there is also a new bit of training, right? With the new CPI, a lot of things will look very familiar. Verbiage, terminology looks very familiar. But I will include a link in the show notes to access some training through the APTA for CPI 3.0. All right, so let me share my screen here. There we go. So for expectations of this first rotation on the CPI, at the midterm portion, we would like students to be at the advanced beginner skill level, and then by completion of the 10 weeks, we want them at the intermediate skill level. So I've just included a little example here of one of the sections. And so obviously the topic here is interpersonal. And the subheading is communication. Like before, they give a description of sort of what this section entails, and then that's followed by the rating scale. Very familiar, that 6-point Likert rating scale. So you can see advanced beginner as a 2, intermediate as a 3. Underneath that, supervision with respect to a caseload. This section, you don't see this on all 12 of the criteria. The reason being, some of the criteria don't require a reference back to a caseload. An example of that would be the criteria with respect to professionalism and ethical behavior or ethical practice. So there's really not a situation where a student should require 75 to 100% supervision of a caseload when it comes to ethical practice, right? We expect that all the time. So you won't see this particular subheading in those, but I do like it in these sections because it gives you, again, some good guidance in terms of, are the students meeting the proper criteria? Finally, this last section, the sample behaviors. We saw this before in CPI 2.0. But what I like that they've done here is they've broken it down by these different different areas, right? And so they give an example or a set of examples for beginner and advanced beginner performance, and then subsequently for further on up in advanced skills. Whereas before it was just one lump of example behaviors, I believe. So we'll be using CPI 3.0 again. The platform we'll use is through APTA, so you will receive an email through the platform from us that will allow you to digitally do this. We're not doing it on paper. It's all going to be done and submitted digitally. There will be a place on the CPI, if anywhere. One area that they of note that they did drop was a specific section with regard to safety, because really the governing body who put this together and reviewed it felt that safety ought to be a part of every one of these criteria. And so you will see a checkbox where if you have concerns about the student's ability to practice safely, you can check that checkbox. However, I would encourage you that if you run into that, right here, my contact information, right? Email me, call me, please reach out if we start running into safety issues with our students. We, the program, would like to be a part of that in making sure that we remediate as necessary. So don't wait till midterm, reach out at any time. A couple other aspects of assessment for our students. So obviously the CPI carries a lot of weight with respect to their grade. However, there are other factors. So the students will have weekly discussion postings. We have a whole variety of topics based on whether it's an inpatient or an outpatient experience, overseeing support staff, billing, individual, how HEPs are designed, things that are going well, things they could do better. So they'll have discussion postings. In addition, they have a weekly clinical tracking form. So this form is just where they come up with goals for the week. A lot of these goals will carry over week to week. We understand that because they'll be developing throughout the 10 weeks with you. But there's also place there for you as the CI. They ought to be bringing this tracking form to you. And you can jot down a couple notes if you'd like. Let me know how things are going. I'll be looking at these each week, as well as there's a box there. If for any reason you want to connect just to talk about something with respect to the rotation or the student in general, you can check that box. And when they submit it to me, I'll reach back out to you and we'll set up a time to meet. So that's how we're utilizing the CPI and assessing our students. The one other aspect that we are going to ask for, because it's a tremendous help, is we're a developing program and we're always looking to improve. There are 2 additional forms along with the CPI that you'll receive from me. One is the CI assessment of the program. This is an APTA document put together. A lot of you are probably very familiar with it. And the other is the APTA's document on the CI's assessment of the DCE, myself. How well I am fostering this experience for the students, their preparedness, my communication with you and with the site, with the SCCE, with the CI. You guys have the advantage of taking students from all different programs. And so there are going to be things that you see in other students, other programs that you really like. You like the way they communicate or certain aspects. And if those things are working well for you, we want to emulate those things. And so I encourage, please give us all the feedback that you can. Those things will come near obviously the end of the rotation. So I will be reaching out around midterm. So the goal is, whenever possible, to be able to meet face to face. Zoom is a great thing, but there's nothing like being able to visit a clinic and meet face to face. But I know that's not always feasible. So we'll work on setting up a schedule to either do an in-person or a virtual meeting around midterm. That'll either be done by myself, the student's advisor, or one of the faculty here in the PT program. And then, of course, at completion of the rotation, we won't meet again unless we need to, but the students know that they should be setting up a meeting with you to review their final CPI. So I know clinics are busy and nobody has enough time to get everything done that needs to get done. But we hugely appreciate it. I hope that you'll find the time to complete the CPI at midterm and final, to have a sit down with the students. It helps them. We've all been there. We've all been students before and benefited from CIs, investing in us and our education. Again, thank y'all so much. This is a milestone for our students, our program. We want to put out the best product possible. We want to have students and graduates who give back to the profession. So we want these to be great experiences for them and for you. So if there's anything that I can do to assist, again, please don't hesitate. Reach out to me, email, call. I'm available to you. And we look forward to this time. And again, thank you so much.